Hello, Mr. Robinson. I'm Amanda Robinson, and I am a student here at Fort Hays State University. I would like to ask you a few questions about your health, maybe what's kept you healthy, and maybe some potential problems in the future. So, could you tell me what brought you in here today?
Just here for an annual checkup.
Have you had any potential problems, maybe that has lingered you more here?
No, everything's been great.
Okay, good. I would just like to ask you a few things about your past health. So did you have any childhood illnesses or diseases as you were growing up?
No.
Did you have your current immunizations, like your measles, mumps, rubellas?
I believe so.
Okay. Did you ever get the chicken pox?
I did not.
You didn't? Interesting. Have you ever had any accidents?
I had a dog bite me.
Could you tell me a little bit more about that?
It bit me in the eye and put me in the hospital for 7 days.
How was that for you?
Long.
Have you ever had any chronic illnesses?
No.
Why can't I do this? Sure, I'm screwing up. So you had a dog bite you when you were how old?
10.
And what hospital were you at?
BB RMCA.
Can you remember the condition that they treated you? Can you remember like how they treated you?
Just infection.
Infection control. And how long were you there?
7 days.
7 days. Do you remember who your doctor was?
No.
A long time ago, wasn't it? Can you tell me when your last examination date was?
No.
Have you ever had a annual examination?
No.
You haven't?
No.
We'll get into that a little bit more. So can you tell me when your last dental checkup maybe was?
Dental was just a month ago or so.
Any problems with your vision? Are you nearsighted, farsighted?
You asked me dental.
I mean, dental? No
Nope.
problems.
Teeth great. No cavities.
But you've had braces.
Yes.
And what about your vision check?
Vision check was about the same time.
Same time. And are you nearsighted or farsighted?
I am nearsighted.
And wear contacts?
Yes.
Any problems with your hearing?
No.
Any any allergies? A little bit of a jokester. Any allergies?
No.
So no allergies to like food. What about environmental? Pollen?
Within the last
Dust.
year, it seems in the summertime I get a little congested.
Seasonal. Do you have any food allergies?
No.
No medicine allergies. Could you tell me, are you on any current medications?
No.
What about vitamins?
The old wife makes me take a vitamin.
So that's actually considered medicine. So when you go into and somebody asks you something, you actually want to tell them if you're on a vitamin or not. And the main reason for that is because maybe a pill that they prescribe you could interact with any, like, especially like herbal medicine, like a lot of people do like herbs and minerals and things like that, because it could interact with a drug that a doctor could prescribe you. So, can you tell me, so is that one a day?
One a day.
Okay. Do you use any type of tobacco products?
I smoke.
You do, and how long have you been smoking for?
For a while.
What's for a while?
15 years.
15 years. Have you ever tried to quit?
I've tried.
You have. And how much would you say you probably smoke a day?
We're getting close to a pack a day now.
Pack a day. Do you use alcohol?
No.
You don't use alcohol much, huh? What about your family history? So this would be like your dad, your mom, maybe your grandparents. Do you know if anybody in your history, in your family, has ever had any heart disease?
Yes.
They have. Could you be a little bit more specific?
My grandpa, on my dad's side, had a bypass surgery.
About bypass surgery. How about anybody having like hypertension or a stroke? Hypertension, by the way, is high blood pressure.
I think everyone in my family, every single person.
But not you, huh? Have anybody ever had diabetes?
I just found out Dad does a little bit, and Grandma did also.
Do you know if he takes insulin or if
I do not.
you don't? Anybody have any cancer, like breast cancer, ovarian cancer,
Not in the immediate family.
arthritis? Nobody else in your family has allergies?
No.
Nope. Anybody else have like alcohol or drug addictions?
No.
Nobody. Anybody else have a mental illness?
Pretty boring.
Pretty boring, huh? Do you know if you've had your tuberculosis shot?
I do not know that.
You don't ever remember anybody ever like taking a little needle in your forearm and put a
Oh,
little
yeah.
blub?
Yeah. TB, middle school,
But you were obviously it came back negative.
obviously.
Okay. So let's see. Could you tell me like have you gained or lost any weight without trying in the last 3 months or so?
No.
Greater than 10 pounds? No. And could you tell me, are you on any diets? Do you diet at all?
I just try and eat good.
Eat healthy. Have you noticed any like weakness or fatigue? Fatigue is tired, being tired? No. How about a history of any skin diseases? Like, do you know what eczema is? Do you have any kind of skin diseases? How about any recent hair loss or change in your texture? It doesn't look like you've lost any much. What do you do to prevent yourself from the sun for your skin?
Suntan lotion.
You do use suntan lotion.
I do.
Long sleeves, hat, maybe? No, none of that. Well, it's a good idea, maybe, to try that. How about eyes? You already said that you're nearsighted, but do you have any difficulty, like with maybe double vision, blurry spots? Do you have noticed any discharge from your eye? No. So, how about any recent ear infections or earaches? Do you notice any ringing in your ears?
No.
How about your nose? No discharge or frequent colds, like sinus troubles or anything like that? Nope. How about your mouth? Have you noticed like any sores in your mouth, sore throat? Do you get like a sore throat often?
No.
Nope. How about bleeding gums, any toothaches? Have you ever had your tonsils out?
No, I have not.
No. So obviously one of my things I would tell you is to go to a dentist on a regular checkup, 6 months or a year, whatever your insurance tells you to do. And do you have any problems with your neck? Like limited mobility, any lumps on your neck that you've noticed? None of that? And how about your axilla, or what we call armpits? Do you notice any tenderness or lumps in your armpits? No swelling, rash? And your respiratory system, do you have a history of lung disease?
No.
And nobody in your family that you know of has had a history of lung disease? Asthma? How about any chest pain, like chest pain with breathing?
No.
No wheezing or noisy breathing when you notice it?
Snoring.
You do snore. Snoring that wakes people up? There's
I've
actually a test that you could take to see if you qualify for needing a CPAP.
been told.
How about cardiovascular? So your heart, do you notice your heart like palpating, like racing at all? Or are you short of breath when you overexert yourself? How about, do you notice any edema anywhere? High blood pressure, you had said no about that. How about, do you know if you're anemic?
Don't know what that is.
Anemic means you're low in iron. So you probably wouldn't know. You've never had an annual checkup before to know what your lab values are. Something that you may want to check out. One thing I would tell you for your health promotion on that would be maybe to go and get your labs checked. Find out what your cholesterol level is. Find out what your red blood cell level is.
Is it all from blood?
Mm-hmm.
From my finger or from my vein?
They will take blood from your vein.
Okay.
Moving on. All right. Do you know, like, so for your peripheral wise, meaning, do you notice like your fingers or toes being cold or numbness, tingling, nothing like that? Do you notice any swelling of your legs, maybe? Well, one thing, does your work involve long-term sitting or standing?
Lots of sitting.
So one thing I would say, do you cross your legs?
Yes.
One thing you probably want to do at the knees, you want to just do the ankles
Why?
because it cuts off your circulation.
Hmm.
What about your appetite? Has your appetite been fair? Yeah. Do you have any food intolerances? Any foods that you particularly can't eat? Doesn't maybe settle right?
Mm-mm.
Nothing like that? Do you notice any heartburn or indigestion?
Mm-mm.
Jeez. Have you ever had your appendix out?
No.
Nope. You've said you have no surgeries. How's your frequency of your bowel movements? Getting a little personal, I realize that, but we kind of got to know.
Pretty good.
Okay. Consistent, they're not like off pattern. Notice any constipation or diarrhea? I would say one thing maybe if you notice that is there's those over-the-counter stool softeners that you could get on. Something that you want to avoid is using like a laxative frequently, because then your body is trained by only going with those. So it can help cause constipation. What else can I ask? I don't know what else to ask you. So I would say you sound pretty functional and healthy. Doesn't sound like you have a whole lot of things wrong with you, huh?
No.
How about your sexual history? Are you monogamous?
Mm-hmm.
Okay. One thing I would use for that is always use protection. Do you have any disorders, like seizure disorders that you know of? Any blackouts? Things like that? You said you're not a huge person that drinks, so that's one thing that's nice. How about, do you notice any excessive bruising on your body? Or that's another sign of being anemic, is if you bruise easily. So can you tell me, you graduated from high school, did you graduate from college?
Mm-hmm.
You did, with, where at?
North Iowa Area Community College.
So a 2-year school. Nice. And where do you work?
At the newspaper in Storm Lake.
And how many years have you been there?
14.
14 years. Have you ever owned your own business before?
I have.
How was that?
Fun.
It was an experience?
Mm-hmm.
Would you do it again?
Nope.
Probably not. How active are you?
Pretty active.
Would you say you exercise on a regular basis?
Yeah.
You do. And you feel like you're obviously able to perform your activities of daily living on your own, like feeding and bathing and doing all that stuff. What are your hobbies?
Softball, hunting, fishing.
The usual boy stuff.
Mm-hmm.
How's your sleep pattern? Are you pretty good at...
Late sleeper.
You are a late sleeper. So how many hours do you think you'd get a day?
6 to 7.
Do you think 6 to 7 is enough hours for your body to function?
Probably not.
Probably not. So what's something that you could maybe change on that?
Trying to go to bed a little
No,
earlier.
I'm trying to go to bed a little earlier. How is your meal intake? Are you somebody who eats breakfast, lunch, supper, 2 snacks a day?
Maybe a snack bar for breakfast, then lunch and supper.
Okay. And what's something that you do to help cope with stress?
I don't know.
You have children?
Mm-hmm.
So if your child, you could feel stressed, what was something that you would do to help calm that, relieve that? Walk the other room.
Oh, stress with her?
Mhm.
She's driving me crazy? Go outside and do something.
So how would you think your overall health concept is? I mean, do you feel like you're,
Could be a little better, but
for the most part,
pretty
good?
close.
So what's something, can you tell me what's something that maybe you feel that you need to change to maybe better your health?
Late night snacks.
You're bad at eating your late night snacks. What's something that you would eat at night?
Popcorn at midnight.
Maybe apt for an apple,
Mm-hmm.
or something, no carbs, or something. So I would say what you're saying to me is that you feel like you're pretty healthy. You don't have any major concerns. But one thing I would say maybe to you, to recommend you maybe in the future, is to do your annual examinations. It's something that they can keep track of, keep chart of, know every year from year if something's changed. It's only a little prick of the needle in your arm. Is there any further questions I can do for you? Do you have any other questions?
I think I'm good.
Okay, well, it was a pleasure talking to you today, and have a wonderful day.
Fantastic.